Hi everyone, welcome to our presentation titled Closing the Feedback Loop with Patients to Improve Patient Safety and Care. I'm Andrew, a business consultant with the Performance and Business Planning Department of the WRHA, and I'm here with my colleague from Communications and Public Affairs, Lindsay McKenzie. We're pleased to bring you a package of work that has been underway in building momentum for a number of years in the WRHA, and by the end of this discussion, we hope you share similar excitement and ideas for how we might build the healthcare system's collective ability to listen to feedback from patients, clients, and residents, and to act on that feedback for meaningful change. The topics that we will cover today include our journey to adopting experience management technology, which includes an AI module. We've heard a lot about that today, to listen and understand to the feedback provided to us in short form feedback tools. We'll review how we've leveraged a partnership with our client relations team to detect poor care experiences and course correct in a service recovery model. And then we'll share how we've developed a real-time dynamic dashboard to cascade learnings to our participating hospitals and service areas. And finally, we'll discuss how mapping the patient journey right from the early stages of contemplating use of healthcare and right through to service delivery and post-appointment and recovery, and how this helps us pinpoint those really critical points in a patient's journey in which we might intervene to drive improved experiences. This tool has been adopted across the continuum of care in the WRHA, from our primary care clinics and our access centers, day hospitals to the emergency department, inpatient services, and through to home care and long-term care. So you'll hear us today reference patients, clients, and residents to be inclusive of that whole continuum of care. Every interaction in healthcare presents an opportunity to improve, and the benefit of a publicly funded healthcare system is we collect a lot of data. Sometimes we're drowning in that data. There's chart abstracts from clinical notes, billing tariffs, there's timestamps at every stage a patient runs through an emergency department. But one of the things that we don't do the best job of is leveraging unstructured data, like comment boxes, call logs, and patient surveys. So I pose this question to the audience today. What if we could make sense of unstructured feedback from patients, clients, and residents during the delivery of care, and then use that data to drive improved experiences? Other sectors have adopted this type of model, like when you attend a concert at our Canada Life Centre downtown and you have a feedback survey in your inbox before you've even left your seat. Or when you make a large purchase, like a vacuum cleaner from Dyson, and they send you prompts at intervals at the 1 month, 9 month, and 18-month mark to find out if their product is meeting the mark and to tailor their communications to you. There's a few extracts of feedback received from patients that have been redacted and generalized for presentation today, and I'm going to walk you through them here. So for the red speech bubble in the middle, what if we could intervene on that experience, apologize for the unfriendly behavior experienced at registration, and better yet, demonstrate the next time this patient comes in to receive their ultrasound or their scan, and demonstrate that improved behavior, that we've made the behavior change that they've recommended. For the yellow speech bubble, what if we could change our practice so that our scheduling clerks indicate the time allotted to schedule the appointment ranges from 15 to 20 minutes so that transportation return to their home can be arranged appropriately? And what if for the speech bubble in green, we feed this comment, this positive comment, back to the team on the surgery unit at a daily safety huddle or through their manager to commend the work and that the friendly environment that they're creating on their unit is being noticed and acknowledged by patients? I'll give you a moment to envision how our healthcare system might operate differently if we could scale our ability to listen, understand, and respond to clients in real time. So if you thought about things like healthcare becoming a more client-centered experience, more satisfied patients, delivering safer care, we as a team think that you're on the right track. So let's talk about how we move from a long-form retrospective survey to a point-of-care tool across the WRHA, which represents just a really small part of this journey. We heard in an earlier talk about incremental change, and I think we're sort of on step one here, and we want to demonstrate some of those successes to you today. Traditional long-form surveys require an extended period of time to make their way into informing quality improvement efforts, whereas the new tools that we're using, experience management digital tools, unlock quicker turnaround to recover poor experiences, to intercept potential safety events, and inform those longer-term system-wide changes that come from consistent quality improvement efforts. They collect data at the point of interaction with the healthcare system or the healthcare provider when your emotions are really fresh, And just like the example I gave to open this presentation and how Dyson contacts you at the 1 month, the 9 month, the 18-month point in your ownership journey, in healthcare, there's similar really key moments when a positive interaction is critical to the overall experience of the patient. So in an ideal model, we collect feedback at each of those phases of awareness, of consideration, of service delivery, and post-recovery. And modern experience management recognizes that your experience with the healthcare system goes well beyond the walls of the medical facility itself. And so that's where mapping the patient journey comes in. By identifying those really critical and influential points in a patient's journey, we can identify and fix problems that have an actual impact on the care experience and discover the unmet needs that may otherwise go undetected. So this is a timeline of events that led to a pilot project evolving by the WRHA that are grounded in some of these principles. For more than a decade, the Canadian Patient Experience Mail-Out Survey has been a standard method for collecting experience data across Canada, but it tends to be delayed, it's retrospective, it's expensive to administer, and has traditionally lower response rates. So in the fall of 2021, a project team was launched, and we were attempting to address the problem statement that patients need an easy way to give feedback on their healthcare experiences so that our organization can take action to deliver timely, compassionate healthcare. The project team would conduct an EnviroScan. We'd look at some validated tools across Canada. We wound up launching a short form survey of 3 questions: the overall experience, whether the client was treated with dignity and care in the service that they received, and what could be done to improve. The feedback tool was adopted. It was rolled out regionally in the fall of 2022 using an in-house tool. And as part of this pilot, we had configured push notifications to go out directly to quality consultants that are based in our hospitals and our sectors, for incorporating into their quality improvement plans. So we demonstrated some quick successes. We had great response rates of over 1,200 responses coming in every month. Our quality teams were looking at the data and informing improvements. And one of the unique efforts that the fruits that came out of this was that we were getting a lot of positive comments back. And we've been working really hard to route those back through managers and through our daily safety huddles to recognize the great work that our healthcare teams are doing day in and day out. And so this is where experience management comes into our journey, because we recognize the need to have a more sophisticated technology to cascade our learnings to dashboard results and really drive action. Adopting this technology also enabled us to unlock one of the more powerful features, which is closing the loop with clients that had poor care experiences through a partnership with our client relations team. So for the next set of slides, I'll turn it over to Lindsay to speak about how experience management is being employed by the WRHA for system change.
Thanks, Andrew. So let's talk about experience management, what it is, and how it's that catalyst to unlocking system change. So when we talk about organizations in the public sector, we're very good at scaling operational changes. So we heard a lot today about that Lean Six Sigma methodology. And so technology has allowed us to find cost savings, to have significant impacts on the bottom line, and find ways to make it more efficient for the ways employees work. But when we talk about digital transformation as it relates to feedback, this is where we want to optimize for that unstructured data. So it's things like free text fields in surveys, reviews on Google, and social media. It requires different technology to make sense of these insights, which are found in thousands of interactions monthly, so that the public sector can take action to improve service delivery. One of the first things that was really critical in our own transformation journey is around cross-functional governance for system change. And so culture is a key piece with any digital transformation. We've talked about that. What I would put to you is that we're using human-centered design to inform this kind of change. So it's about people and process changes where we're putting the citizen we serve at the heart of problem solving. So change management, certainly a growing practice, and it comes with adopting new ways of working. And experience management is the same. So change is occurring at multiple levels, be it at senior leadership levels where we need to build awareness, desire, and knowledge of the need for change, and whether it's at the employee level where we need knowledge and we need retention of those skills so that there's a comfort in using this technology. In our case, provincial legislation directed us to find ways to measure and monitor the patient experience across the entire region. And so our cross-functional working team coalesced around this problem statement from a reputational perspective, from health outcomes perspective, and from a business and performance planning perspective as well. So here's how we operationalize the patient voice. So I want to point out, we've talked about feedback loops today. There's two specific types of feedback loops when you're building an experience management program. One is that outer feedback loop. And so that outer feedback loop is what's driving system change. So it's across the organization, how it can listen. So take in all of that feedback through many different channels, understand, so using AI and natural language processing models to build dashboards that drive action, and then act. So how do we get that information into the hands of executive leadership to move things forward and make decisions? That second piece, and Andrew talked about this, but our huddles. So how do we take those themes and patterns and insights, those trends, back into the people that are delivering the care, back into those conversations? And so that inner loop now becomes where the employee is empowered in the work that they do to make change and deliver better service. And so that inner loop is about listen, resolve, and communicate. And that is specifically between the public sector employee and the citizen who requires that service. So here's a look at experience management capabilities. So this system, this technology, is able to interpret data that's coming in, so that unstructured and structured data, in the broadest way possible. So speech, video, text, surveys, and it can aggregate all of that data. It also gives us the capability to understand the patient journey or the employee journey through AI-enabled analytics. So it is natural language processing, large language models, to be able to build those kinds of dashboards and workflows that we need to take action with what patients are telling us. And the last piece here, which is critical, and we heard a little bit about this in the ServiceNow presentation, but how do we actually create alerts, notifications, workflows, so that at an employee level, they can drive decision-making, they can drive better service experience. And lastly, we certainly work in an environment where privacy is important, security is important, and so we need a technology that can scale with us, that can be integrated into other systems of record, like HRIS systems or ERP systems or electronic patient record systems, and know that the information that's being collected from patients and employees is being done in a safe way. So I want to talk to you about some examples of where we're seeing this technology pay off for us. A couple examples of our outer loop feedback process. What I'll do is highlight one of our sites that we saw repetitively situations about parking occurring. And so what that technology brought forward for us was that theme and the sentiment on that theme. And so by aggregating that data, we could take it and make it digestible for leadership, and leadership could take action with that information to be able to allocate a number of parking spots for those patients so that they could have an easier experience going into day hospitals. And since we've adopted that change, the feedback that we're getting on parking has decreased. So we're not seeing that same level of feedback. So it's an example of that listen, understand, act loop. When we look at another example, online booking, this is one where we were getting a number of complaints about the online booking process. And so again, we're able to take that, group it, give it back to leadership for some decision-making action around improving that online booking system. The work that we're doing now, one of the things that we're seeing with online booking systems is that people are telling us they feel they have more control over their schedule. They can book appointments when, how, and where they want, and they're not waiting for the clinic's office hours to be able to reach someone on the phone. So it gives them a lot more control over accessing a service. The last piece here really is about that inner loop. And so we talked about the short form survey and where we're able to empower the organization to take action. When you submit a survey, and if that survey has an experience score of 6 or below, or you say you did not receive dignity and care, what that survey does is it asks you if you'd like a follow-up from one of our patient relation staff members. And so we can see in the data that about 1 in 5 of those survey responses would warrant a follow-up. To date, in the pilot that we've done, we're close to about 200 people that have taken us up on that. And so what we're intercepting, about 20% is usually customer service issues where communication's broken down or the interaction has not been positive between the patient and the care provider. But in 2% of those situations, we're actually intervening on potential patient safety events. And so if we can even intervene on one, that's a win in our books. And the rest of these examples really are about giving us more information so that our patient relations staff members can really walk with patients in their care journey and provide them the support that they need. So Wendy Singleton and a number of actually WRHA's leadership are here today. And so Wendy's been a key member of our team as we've been innovating with experience management. And she handles a lot of these calls, all of the calls, to be able to give people the sense of being heard and that something's going to happen with what they're telling us, that we can improve that experience. So really in closing today, thank you very much for your time. We hope that what you'll take away is the importance of front-end digital transformation efforts and how experience management plays a role in making sense of those attitudes and behaviors that citizens have about the public service that they're receiving. And so it helps us make sense of all of those things in a way that we can easily take action with and empower the workforce to do something to make change. So thank you very much.